Globalcast MD, along with Cincinnati Children's Hospital, sharing knowledge to improve child health around the globe.
What do you do if a patient develops a second tracheoesophageal fistula years after repair? I'm Jill Kneprath with Recurrent MD. In this video series, we'll be sharing some of the highlights from our annual Pediatric Surgery Update course in 2025. Today, we're going to review the management of recurrent tracheoesophageal fistulas, or TEFs, with Dr. Doug Van Allmen, an ENT specialist at Cincinnati Children's.
This was a 7-year-old who came to us, had a history of TEF, EA, had a repair, and was having chronic cough as well as food impaction. She was referred for the esophageal diverticulum, but we were involved to evaluate the airway as well.
She had a few dilations without any improvement. The right side shows the esophagectomy.
This is the esophageal anastomosis, and as you back up, you can see there's a little ledge that's been formed and just a dilated upper pouch.
This is the bronchoscopy video. You can see some granulation tissue along the back wall.
Second fistulas or H-type fistulas can be really hard to deal with endoscopically sometimes. So this was the esophagram showing that mismatch and the outpouching.
The recurrent laryngeal nerve is at risk of being damaged during repair of recurrent TEFs. How can we reduce that risk? The answer is a transtracheal approach to provide better exposure.
This shows a distal tracheotomy here with the ET tube. Do a bronchoscopy to help localize the level of the fistula and then make a tracheotomy over the fistula. Work through the tracheotomy to divide the layers of the esophagus.
This approach helps minimize injury to the recurrent laryngeal nerve.
Recurrent laryngeal nerve injury is underreported. If it is a true paralysis over time, that muscle atrophies. They have long-term voice problems and potentially have issues with aspiration.
In summary, recurrent TEFs can present years after repair. A transtracheal approach can improve surgical exposure and reduce injury to the recurrent laryngeal nerve.
Globalcast MD, along with Cincinnati Children's Hospital, sharing knowledge to improve child health around the globe.